Here's the thing about putting off reporting on an AI development. You put it off too long, someone else releases a similar thing, and now you have to talk about both of them. I really want to talk about how AI open chat. What is this thing? Open AI. Woo! OpenAI released ChatGPT Health. And the moment I saw it, my head was spinning. I was like, wait, what? It was a mixture of excitement and concern, all wrapped up into one confused ball. Like, talk about mental dissonance. What's the phrase called? I forget. Like, let me explain. Let me explain why. Sometime last year, towards the end, my 1-year-old just was in and out of hospital for about 34 months. And at first it was tonsillitis, and then it was that, and then basically he had to see a specialist or two or three. And I can't tell you what a privilege it is to work in healthcare, to be a mom who can advocate for her son because she's in healthcare. So why I'm saying that is that the quality of our conversation, the quality of my conversation with the physicians or the specialists that were attending to my son would not have been the same had I not been someone who's in healthcare. And sometimes I don't lead with that. Most of the times I don't lead with that. I'm a pharmacist by profession. So I don't lead with that. Usually I want you to tell, because this is your jurisdiction, right? So I want you to tell me what you think. I don't want you to tell me what you think based on what you think I'm going to say. You get what I mean? But anyway, I think I found that when the physicians know that you understand basically what they're going to say. I'm not saying I understand everything. I'm not a physician. I'm a pharmacist. If we're talking medicines, yes, we can talk. But yes, the quality of our conversations were different. I remember there was orthopedic surgeon who came around with a student, and they talk to you, but sometimes they talk about you to each other, because obviously he's teaching the student. So he mentioned something about, okay, my son getting Augmentin. Well, I think he mentioned that, okay, he was supposed to, or he didn't get Augmentin. That's an antibiotic. And then I was like, no, he did get Augmentin. And it stopped him right in his tracks. Yeah. And then he goes, are you in the medical field? And then that's when I was like, ooh, my cover's been blown. So I'm like, yeah, I'm a pharmacist. Both of them at the same time go. Then after that, I can tell you the quality of the conversations. I think I was also very excited because there's a level of explanation or level of conversation that he gets to have because I can understand what he's saying. Even my son's pediatrician, when the results would come in, she would basically show me on the tablet, because now they carry around tablets, and say, okay, these are the blood results, this is what's happening, this is what's high. And I think if I was like a regular mom who was not in the medical field, she would have said, the results say 1, 2, 3, and left it at that, right? But no, I was in the conversation. I was in the trying to figure out what's wrong, because they didn't understand what was going on. That's why he was sent to specialists, to different specialists, and the thing happened to just resolve on its own. Luckily, it wasn't like a fatal situation or very serious. It was serious in that he couldn't walk at some point. It's hard to see a toddler not being able to walk because of his knee, but then he just recovered spontaneously. We had to put him on pain meds. Anyway, that's not the point. My point is the quality of the conversation was different. I was an active participant in the discussion of my child's health. And I am generally an active participant in my health whenever I have to see the doctor. So when ChatGPT Health came out, and can I say 72 hours later, is it Anthropic? No, it's not Anthropic, it's Claude. Claude AI as well released their health AI. Anyway, but this is about ChatGPT. I understand from a patient's perspective to be able to walk into the doctor's room prepared, because you are able to, I think you can upload your results and upload your medical records and things like that. This can become a very murky area because of data safety and a lot of things, but I'm still talking about the being equipped and being empowered. A patient who is basically empowered by AI, and they get to ask really good questions. My concerns as a pharmacist, as a regulatory pharmacist, who's very cognizant of compliance and, protecting the patient and protecting the public. The normal guy does not know to input ample information or ample data into the AI for it to give an accurate output. My problem is this person will input information that is incomplete or incorrect, and say ChatGPT Health decides to give you an OTC medication, over-the-counter medication that you can get. You don't need a prescription. That's a sigh of relief, because because as you know, there are a lot of medications that you can't get without a doctor's prescription. So what if it tells you to get something and you're allergic to it, or you're already taking something and their drug interactions could be fatal? Things like that. And that's only just one aspect. What if it tells you have cancer? Have we not learned with what was it, WebMD, something like that? And I'm not trying to be a party pooper. I love AI. I love what the potential of AI can do and how it can change the face of healthcare altogether. I love it, but I am really concerned about the inaccurate information that can be given, because the person who's inputting information is not educated enough or does not know better to put in the relevant results or information, things like blood type, or if the diabetic, I was going to say diabetic, but those people are usually, people who are diabetic, they usually are quick to say, okay, they're diabetic, because, it's a life or death situation. So that's why I'm kind of two ways about it. One, it really empowers you, and I can see what privilege it can give you. The privilege that I have that I didn't realize I had until I had to think about the release of ChatGPT Health as well as Claude Health, and how a normal person can be given the privilege that I have of having studied in the medical field. Secondly, can you imagine a mom now giving their toddler or their child something based on what ChatGPT said. Because the other thing with ChatGPT or these AI apps is that they say things with so much confidence, and you have to push back to be like, is that correct? Myself, as a pharmacist, as someone who's in healthcare, I can kind of pick up when it's kind of losing the plot. But how will a regular person pick up when it's losing the plot? So I think, yes, I welcome good technology. I welcome technology that empowers people. But my concern is, could there be guardrails? Things like data safety. And in the healthcare profession, it doesn't matter what you studied. We speak a lot about, patient confidentiality, and it's their information on their file shouldn't just be shared with anyone. So and I know they're saying ChatGPT Health has a lot more security compared to regular ChatGPT, but I am still concerned. I think things are moving fast, and I think the regulators are not moving fast enough. We're kind of at a reactive phase, as Sam Altman and friends are moving way faster than everyone else. So I think the regulators need to be proactive. I think we need to be proactive. I'm not a regulator in that way, but I'm like in the regulatory space, but for other things, not for AI. But I feel like we need to move faster, because some and them are moving fast, and I feel like there are not enough guardrails in place. I don't know. You let me know what you think. Because I know it also helps people with their women who it helps them with their like cycles. Because I've taken a screenshot of my Ovia app interface and said, okay, I almost told you guys my business. I've taken a screenshot of my Ovia app, my cycle app, to help help me understand what's going on, because there was a time I was like on a very low carb diet, which I am still, and my cycle kind of changed. It wasn't like super regular anymore. Like, just there were some things I needed to understand. In that sense, it was helpful, but it was also off, and I could pick up when it was off, and a lot of people can't pick up when it's off. So, good and bad. But please don't give your kids medication based on what ChatGPT says. Speak to a doctor, speak to a pharmacist, speak to a healthcare professional. And they do say, Sam and them, please, it does not replace your healthcare professionals. Still speak to them. It's just there to empower you and let you know what's going on, or explain things to you in a way that you understand. I know there are certain healthcare professionals who are not really the best at translating information, and this could come in handy. They could kind of be a middleman. But I don't want us losing the human effect with AI. I think more than ever, people need to start learning human skills. I think we're there. Introverts, it's time to shine. I know we like to we like to pretend we don't like people, but I think we do. We do like people. We might like them maybe one-on-one, but I think we're very emotionally intelligent. And I'm just thinking, and I'm imagining it's time. It's time for us to shine, introverts. It's time for us to shine. But yeah, so that's my 2 cents and my video diary for the day. I'll catch you tomorrow. Bye.